Capitol Watch. New data shows Missouri has one of the highest death rates for pregnant women in the country. The state report points to mental health as a top issue. Our Missouri Capitol reporter Hannah Falcon shares how this is being tackled in Missouri.
It's not uncommon for pregnant or postpartum women to experience depression, anxiety, or what's often described as scary thoughts. But while widespread, these mental health issues often go unaddressed.
It wasn't seen as like a critical thing that was assessed at the time.
Allison Williams is a registered nurse who now works with the Missouri Hospital Association and Pregnancy-Associated Mortality Review. A new state report outlines just how severe and widespread mental health issues are for pregnant and postpartum women.
We see it as a failing, as there's something, quote unquote, wrong with you that's different than maybe a physical medical diagnosis. But in reality, it can be really challenging, and it can create a lot of depression, anxiety that, quite honestly, spirals out of their own control.
And she would know from personal experience.
With both of my pregnancies, I dealt with anxiety and depression, and with my second, it was pretty severe.
Mental health issues can manifest in many different physical ways. Unfortunately, some can result in suicide. Between 2017 and 2021, 14% of maternal deaths were suicide. But Missouri has invested more than $10 million to help address this and other issues plaguing pregnant women.
So you can see now in the state that we have programs that have opened already in a very short period of time.
Dr. Jean Goodman says Missouri is already seeing a return on that investment.
The maternal health access perinatal program that I mentioned, that's being run through the DHSS, is funded from our state, and that provides access for any provider caring for a woman before, during, or after pregnancy to immediately be connected with someone with expertise in providing counseling.
Goodman and Williams agree. The best way to address the mental health problem is education and connecting women with care. It will still be several years before the data can reflect any changes from the program. Reporting in Jefferson City, I'm Hannah Falcon, First Alert 4.
And if you or a loved one is struggling with mental health or suicidal thoughts, please call or text the National Mental Health Hotline. That number's here on your screen. It is 988.